serve as COVID-19 Operations Chief, and Jason Thorne, the city's Emergency Operations Center Director. And I'm hoping that everyone had a great trick-or-treating experience last night. It was great to see everybody out and about. I can tell you that at my house, I had 3 times as many trick-or-treaters than we normally have. So obviously there's a lot of pent-up demand for getting out there and collecting candy. So nice to see it happening, and I'm sure everyone had a good time. And even though the temperatures are getting cooler outside, we are going to start spending more time indoors in the coming days and weeks. And it's imperative and important that everyone continues to follow the public health guidelines. So some of those guidelines are to continue to monitor for any symptoms of COVID. And if you have symptoms, stay home, get tested. Continue following those public health practices, such as wearing a mask or physical distancing and that hand washing that has served us well, will serve you well through flu season as well. And of course, carry your proof of vaccination to get access to some of those select indoor public spaces, restaurants, cafes, gyms, and other places that we all like to enjoy that are going to require vaccine verification going forward. I also want to underscore the continued importance of getting vaccinated and ensuring that the policies that we are putting in place and that the vaccines that are available are going to help minimize this pandemic going forward. And we're certainly not clear of the pandemic, but certainly it's looking better today than before. So while we're expecting the province to begin gradually lifting proof of vaccine requirements in 2022, depending on some of those key indicators that will determine whether or not we're going to be opening up then or not, this does not diminish the importance of being or getting vaccinated now. So if you haven't done so already, talk to your doctor or any trusted healthcare professional and get your vaccine at your earliest convenience. You'll be better for it. I'll now pass it over to our city's Emergency Operations Center Director, Jason Thorne. Jason?
Thank you, Mr. Mayor, and good afternoon, everyone. I'm going to start from the EOC this afternoon with an update with respect to the City of Hamilton's vaccine verification policy for city staff. So the city does remain committed to promoting vaccination against COVID-19 to ensure the health and safety of all members of our workforce as well as the community. So today is the last day for city employees to provide proof of both doses of their COVID-19 vaccination under the city's vaccine verification policy. As of today, approximately 95% of city employees have reported in with the required information under this policy, with approximately 92% of those employees reporting that they are fully vaccinated. All employees who have not submitted proof of both doses of their vaccine will enter into the city's COVID-19 rapid testing program, which begins on Thursday of this week. So staff in those cases must take their tests from home and submit test results online every Monday and Thursday, regardless of their shift schedule or where their place of work may be. Those staff who do not submit their test results each Monday and Thursday as required will be placed on an unpaid leave of absence. As the city implements this next phase of the vaccination verification policy, we do anticipate that there is potential for some service disruptions related to employees who have not yet fully complied with this policy. So we are committed to proactively communicating with the community regarding any service interruptions or delays. As shared on Friday, the HSR is planning for potential service disruptions beginning this Thursday. As of Friday, HSR was planning for up to 10% of bus operators to be potentially out of compliance with the policy, although we do hope that that number will be significantly lower by Thursday of this week. But to prepare for any potential service disruptions caused by any employees who are not complied with the city's policy, HSR is conducting contingency planning. So if required, HSR will be prioritizing service at the start and end of the day to ensure customers can get where they need to go, as well as identifying any high frequency routes that may be modified where required. And they will be continuously monitoring affected routes to make sure that we are protecting service. I do encourage customers to download the HSR Now app on their devices, which will provide up-to-date information and also to monitor HSR social media channels for any updates to service levels. Of course, we apologize for any inconvenience that this service disruption may cause, and we'll continue to communicate with the public regarding any service disruptions in the coming days, should that be necessary. With respect to enforcement of COVID regulations, there were 37 ROA charges issued this past week, with 21 of them being issued at businesses and 16 at residences. There were also 14 businesses charged with face covering violations this past week. I have a couple updates to share regarding our recreation programming related to the city's facilities as a result of the new regulations coming into force from the province. So the following service changes specific to our rec facilities and programs are now in effect. So physical distancing and reduced capacities are no longer required for facilities or events that require proof of vaccination. As well, some facility amenities such as showers or lockers that were closed due to the distancing requirements have now reopened. And some changes at our pools as well, that length swim capacities will increase to 4 per single lane or 6 per double lane. We do still continue to encourage people to make reservations online in advance. In terms of our winter programming, planning is in the works and more information will be shared in the coming weeks. Outdoor rinks will start to reopen depending on weather conditions. And when they do, they will be returning to normal capacities with no reservations required. Information on some of our volunteer community rinks will be available and shared in the next few weeks. And public programming at our indoor rinks will be returning with normal capacities with program schedules available in the next couple of weeks. For the golfers out there, a few updates. The Shadok-Badeau Golf Course will be closing for play after today. The last day to play at the Kings Forest Golf Club will be November the 7th. The Shadok Martin Course remains open and will remain open depending on the weather. And winter golf details will be available later this month. And lastly, in recreation news, I am happy to announce that the rec annual passes are back and can be purchased starting today. The annual passes were temporarily suspended during the pandemic, but they are now being offered, which gives 4 options for drop-in programming. Residents can choose the way they pay and play, either a single admit, multiple visit clip card, monthly pass, or the annual pass. And information about those passes is available on the city's website. And lastly, I'm pleased to say that the City of Hamilton Remembrance Day service will take place on Thursday, November the 11th, beginning at 10:45 a.m. at the Gore Park Cenotaph. Again, this year, participation will be by invitation only. But the public is invited to view the Remembrance Day service by tuning into the live broadcast on Cable 14 or on the city's YouTube channel. Any citizens or groups who want to have a wreath laid at the cenotaph are asked to once again deliver their wreaths before November 11th to the Hamilton Military Museum at 610 York Boulevard. Those wreaths will then be placed at the cenotaph on their behalf by members of the Hamilton Veterans Committee during the Remembrance Day service. So with that, I will turn things over to Michelle Baird.
Thanks. So we have some good news to share today. Overall, COVID-19 case activity continues to decrease. We have a total of 25,243 cases in Hamilton as of today, with a net change of 30 cases from Friday. COVID-19 activity levels continue to be the highest among those aged 0 to 59, although activity is relatively low among all age groups at this time. Our 7-day moving average number of cases reported per day is at 14, and the weekly incidence per 100,000 population is 16, with our most recent updated weekly reproductive number sitting at 0.83. The average number of daily new hospitalizations is low, and there is currently less than 1 new hospital admission each day on average. The average number of deaths occurring per day remains very low as well. Our percent positivity continues to trend downwards. We are currently sitting at 1.7%. Currently, there are 7 active outbreaks, with 2 new outbreaks being reported today. The information about these can be found on our COVID-19 dashboard. On the vaccine front, in terms of our progress, the Hamilton Healthcare Partners have administered over 861,298 COVID-19 vaccines locally, with an estimated 85.2% of Hamiltonians born in 2009 or earlier receiving a vaccine to date, and 81.3% are fully vaccinated. Hamilton Public Health Services and our partners continue to scale up Hamilton's vaccine program in preparation for the next phase of the COVID-19 vaccination campaign. We are working closely with partners from our local school boards and McMaster Children's Hospital to scale up operations in preparation for the vaccination of children aged 5 to 11, including offering family-friendly clinics and an age-specific vaccine confidence campaign. Details will come soon. This is to ensure readiness as a community once Health Canada and the National Advisory Committee on Immunization, or NACI, provides approval and recommendation on the Pfizer COVID-19 vaccine for children 5 to 11 years of age, along with direction from the Ontario government. When it comes to scaling up, it's also necessary to note this past Friday's statement from NACI on recommendations with regards to third dose eligibility for community members 70 years of age and over, Indigenous individuals 18 years of age and over, high-risk healthcare workers, and those who received 2 doses of AstraZeneca Covishield vaccine or 1 dose of the Janssen vaccine. At this time, we were awaiting direction from the provincial government on third dose eligibility in Hamilton and across Ontario. With these anticipated announcements top of mind for many in the community, Hamilton Public Health Services and our healthcare partners have some important updates to share this afternoon. This month, Hamilton Public Health Services is opening 2 new fixed-site COVID-19 vaccine clinics. This Wednesday, Hamilton Public Health Services Mountain COVID-19 Vaccine Clinic will open its doors at CF Lime Ridge Mall on the upper level near entrance 5. Hours of operation will be 9:30 a.m. to 3:30 p.m. from November 3rd to the 14th, and then from the 15th onward to the 21st, we'll be operating 1 to 7 p.m. A second fixed-site COVID-19 vaccine clinic will be open in the Lower City before the end of November. At capacity, these vaccine clinics will offer 550 vaccines per day. To support appointment booking and a more local customization, we are also launching a local COVID-19 vaccine booking system to replace the province's booking tool in Hamilton effective today. The new online vaccine booking system using Virto Health can accept bookings for eligible residents with an Ontario health card, a green photo health card, or a red and white card with an email address or cell phone number. And these can be accessed by visiting our website. Individuals without a health card or without an email address or cell phone number can call Public Health Services at the vaccine hotline 905-974-9848, and it's option 7. Translation services are available by phone as well. Let me be clear though, despite these announcements, our last mile strategy continues to be our top priority, offering first and second doses for those 12 years of age and older before the end of 2021, reaching a 90% vaccine coverage in Hamilton and ensuring neighborhoods with lower coverage rates have access to the information tailored to their needs and vaccine that is accessible at convenient locations and times. To underscore this commitment, mobile vaccine clinics will offer 2 mobile clinics each day, 7 days per week, in more consistent and predictable locations to offer Hamiltonians more steady and consistent services. Primary care-led clinics downtown at the David Braley Health Science Center Vaccine Clinic and Winterberry Family Medicine on the Mountain, along with over 100 participating pharmacies interspersed across Hamilton, continue to be vital partners in offering COVID vaccine. All available vaccine clinics and operating hours are available at hamilton.ca/getyourvaccine. The page is updated regularly with the most up-to-date information. And that's my update for you today. I'm turning it back to you, Mr. Mayor.
Thank you very much, Michelle and Jason. And I think we should all be mindful of the active role we all play in helping keep our community healthy and safe. And there's been a tremendous effort to ensure the health and safety of patrons accessing indoor and outdoor venues, and certainly a tremendous effort in folks in our broader community to get vaccinated and staying safe as much as humanly possible and adhering to the vaccine verification process. So thank you to all of those that are participating and actively doing your part. And getting vaccinated is still very important. And so if you want to protect yourself, get the vaccine. If you want to protect your family, get the vaccine. If you want to do right by our community, get the vaccine. Still very important, and more work being done to look at the next phase of vaccinations, which is children's 5 and up, and boosters for the community at large. So something we can all look forward to. There are incredible sports teams and talented musicians and local shops, bars, and restaurants and cafes in Hamilton. So Every reason to continue to support them in the right way, demonstrating your proof of vaccination as we do that. So please help those businesses by not giving the folks at the door a hard time. It's not their job to make you feel good. It's their job to require you to demonstrate that you have been vaccinated before you enter their facilities. So cooperate. It's quick, it's easy, and can be very, very painless if everyone just cooperates and does what they need to do. So thank you all for your ongoing help and participation in all of this. You know, all of this is working well because the vast majority of our population is being helpful and cooperative and understanding and fully appreciates why these are important measures for us to take. And so let's continue that effort as we head into the holiday season, where we're going to spend more time, closer to one another. And hopefully we'll still be mindful of some of those protective measures that are still going to be important as we go through this pandemic. So thank you. Jasmine, I'm going to turn it over to you for some questions from the media. Please lead us through that. Jasmine.
Great. Thank you, Mr. Mayor. We have 3 media joining us today. So as usual, we will start with 1 question and 1 follow-up for everyone. Our first question will be to Samantha Craigs from CBC Hamilton. Samantha, you can go ahead.
Thank you. My first question, I'm guessing it would be for the mayor. How are you feeling in terms of, are we getting towards the end of this thing? How are you feeling in terms of the possibility of that?
Well, feeling a lot better. Obviously, more things are open. There's the vitality coming back to our city. And even though that, there's some caution that we're still trying to get people to think about and adhere to, and vaccine verification is going rather smoothly. I'm not hearing too many complaints, and I think the vast majority of the businesses that are having to function in that space are doing the right thing. So I'm feeling good about where we are. Residents are doing what we're asking them to do and fully understand why. And so we're in a much, much better place, but we have to maintain some caution and vigilance so that we don't slide back into the kinds of things we see in other places where they've kind of indiscriminately let things go too soon, too early. So I think reasonable caution has been exercised here in Ontario, and I think that you can see the evidence of that in Hamilton and across the province. So feeling good about where we are and feeling very grateful for the help and assistance from all of our citizens and businesses out there. And if we continue this good work, we can expect that we're going to continue to have more openings and more of a relaxed and less anxious environment to operate in. So things are looking up.
I also would like to ask Michelle Baird, do you know how many people you're looking to reach with the first round of 3rd doses?
Yes, thanks for that question, Samantha. So right now we are looking at those numbers ourselves. If we look at it internally and consider what needs to happen over the next few months when we consider both 3rd doses as well as our 5 to 11-year-old group, because of course it's important that they get their first dose too once that eligibility is announced. And we're looking at approximately 100,000 people in that full bucket, if you will. So it's the 3rd dose population as well as the 5 to 11s.
Great, thank you, Michelle. We'll go next to Fallon Hewitt from the Hamilton Spectator. Fallon, you can go ahead.
Hi, thanks for taking my questions. My question would be for Jason. So Jason, at least 14 businesses have been charged for not enforcing the vaccine passport program, with I think at least 9 of those being charged in the last 2 weeks. What could you tell us about the city's enforcement levels when it comes to the vaccine verification program? Is bylaw cracking down at all? It seems that there's been a jump in the fines and the charges.
Thanks very much for the question. And bylaw has been continuing the same level of enforcement over the past many weeks. So we do have a dedicated team within bylaw enforcement who is focused on enforcing all of the different COVID restrictions and COVID regulations. They're continuing to do reactive enforcement where we receive complaints, as well as proactive enforcement across the city, going to different areas, different business locations to make sure that we're getting compliance. So as you see in the results that we reported for this week, which we do continue to report publicly and post on the city website every week, we continue to see some issues with face covering violations. That continues to be one that we continue to have to give notices regarding and issue fines regarding face covering violations. We are trying to do everything we can to make sure that businesses remember that those restrictions are still in place. Putting in place the passport requirements did not affect those masking requirements. Those are in addition to. So we do continue to enforce those. As I've noted sort of in previous media briefings, when regulations are first brought into force, we do tend to start with education and trying to help businesses come into compliance. For the most part, what we're focused on right now is enforcement. These regulations have been in place for quite some time. We do think that all businesses and patrons should be well aware of them. So when we do find violations, we are issuing notices or fines.
Thanks. And my second question would also be for Jason. I think it was about at least 22 businesses that were charged with more than 30 COVID-related infractions last week. That just seems like quite a big jump. Would you be able to speak to that at all? It just seemed like a large number.
So I think we have seen over the course of the pandemic, we've seen weeks where there's higher numbers and lower numbers. Like I said, some of it relates to masking rules that have been in place for a while. We do continue to have some notices and charges issued related to failure to do things like post the COVID safety plan, post proper signage. We do continue to have charges related to some vaccine verification requirements. So there are weeks where we see more, and there are weeks where we do see fewer. But I would say, as I've said before, that the vast majority of businesses are doing everything they can to comply. The numbers that we're reporting in terms of enforcement activity are quite small in terms of the overall number of businesses that we're going out to on a regular basis who are trying to do the right thing and who are following all the rules and regulations.
Thanks, Jason. We'll go next to Joanna from the Hamilton Spectator. Joanna, you can go ahead.
Hi, thanks so much for the question. I hope everyone had a happy Halloween. My first question is for Michelle. I'm looking to find out, can you still do the walk-in appointments now that you are creating this local booking system? And can you talk about, like, this is quite a few changes with adding, fixed site clinics and more stable mobile clinics and this new booking system. Can you talk about, why you felt it was the time to make these changes and why these changes are needed and what you hope to accomplish with them?
Thanks, Joanna. Absolutely. So at this point in time, first and second doses for individuals who are eligible at this point in time. So regardless of the NACI announcement, all of those individuals can come to any clinic. It's walk-in first and second dose, and absolutely encourage people, if you haven't yet had a vaccine, certainly come and do that. No need to book online. The booking system, though, as noted, with so many people becoming eligible for that third dose, we want it to be in a place where we could manage those numbers and give people the ability to book vaccines. In addition, with the 5 to 11 year vaccine, 5 to 11 years becoming eligible probably in the next, coming weeks and months, that we're also coming into the winter now. It's a bit colder, so we certainly want to avoid lineups wherever possible and move people to a booked vaccine opportunity. So right now, first and second doses eligible. If you're eligible, just walk in, no need to use the booking system. The booking system, however, is now available. And as we get that next group of individuals, the NACI eligible for third dose, which we anticipate later this week, then those folks would be individuals who could book. When we look at third dose, for example, there isn't the urgency that we had earlier with first and second doses. Third doses are being provided in some populations where there's some waning immunity. And so there's time for people to book the appointment, get a time and location that works for them, and come in. It's not the same situation we were in earlier where we were trying to get first doses out the door as quickly as possible. Why we're making changes now is that these are different populations than we've been trying to work through our last mile strategy over the past bit of time. We've certainly learned that the effectiveness and efficiency of a large scale clinic allows us to roll larger numbers through in a smaller amount of time. So that's why we're going back to those larger clinics. Certainly not the size you would have seen previously at First Ontario, but larger in scale than our mobile clinics. The other piece around the mobile is, again, expect to be using mobile for those 5 to 11s, also some of these eligibility groups, and that it is helpful where possible to have them in more regular and routine locations. We're also well aware of which locations worked well for us, where we might have had some challenges over the past few months. So trying to choose locations with great accessibility and in places where people are coming to receive their vaccine. Also, different time and place in that we're now well established with pharmacies, lots of pharmacies across the city, well over 100 that are offering COVID vaccine. So certainly there's disbursement well into neighborhoods through pharmacy. And in addition to our 2 large primary care COVID clinics, we have more and more individual primary care providers coming on. So really trying to put clinics where people need them, but also realizing that there are a number of different channels. When we look at the healthcare worker group, for example, many employers are now in a place that they can offer vaccine. So certainly it's just a different time than we were in before, but trying to both make it easy for people and allow them to book vaccines, but always we will continue with the walk-in for those first and second doses, as they do continue for us to be the most important ones to get out the door.
Thanks so much. And my next question is also for you, Michelle. What is public health planning to do about expected misinformation campaigns regarding children's COVID vaccines? You know, how do you plan to combat that?
So we are currently working on a campaign right now that is age specific to help support that 5 to 11 year group. We're also hearing lots of positive messaging and lots of optimism locally about people that do want to receive vaccine in that age group. We're working closely with our school boards as well as McMaster Children's Hospital, as we did with the 12 to 17s as well. And certainly there's been support there in past. So, you know, working with our partners closely, continuing to put messaging out specific to that age group and really helping people and providing supports for them to help them make the decision for themselves with respect to vaccine.
Thanks, Michelle. So we have a bit more time, so we'll go through again for one more question each. We'll go back first to Samantha from CBC Hamilton. If you'd like another question, you can go ahead.
Thank you very much. I'd like to ask Michelle, how much has it cost for us to establish and launch our own booking system?
Hi, Samantha. My apologies. That's not a question. I don't have that information with me with respect to what the cost is on that. I think what I would say is that it's we encountered a number of issues with the provincial system previously and had some challenges with locally being able to customize, and certainly thought that it was worthwhile for us to go ahead with our local system ourselves.
Thanks, Michelle. I'll go back to Fallon Hewitt. Fallon, if you'd like another question, you can go ahead.
Can I add that I'm not sure what the cost is either, but I think it's eligible for cost recovery through provincial funding. So notwithstanding, we can endeavor to get the number in terms of what it might have cost, but certainly eligible for cost recovery for the municipality.
Great. Thank you, Mr. Mayor. We'll go over to Fallon next. Go ahead, Fallon.
Great, thank you. My question's also for Michelle. So speaking to some of the charges, so there's masking charges at hair salons and the vaccine verification charges at restaurants. And like both of those settings would be considered like high to moderate risk for spread of COVID. So like what kind of concerns does public health have about some of these settings not following the rules meant to keep COVID spread at bay? Like, I don't know if you could speak to that at all.
Thanks, Fallon. And yes, that what I would say to that really is as people are vaccinated and we have more people that are fully vaccinated, the vaccine isn't 100% effective, as we know. It's very effective at preventing severe illness, but where possible, you need to maintain compliance with those public health measures, wear masks where possible at indoor settings, keep distances where you can, and just be cognizant yourself that yes, the vaccine does prevent severe illness, but you could still have an asymptomatic infection, a mild infection, and possibly spread to others. So just be aware that all those public health measures are still in place in those indoor locations.
Thanks, Michelle. We'll go next to Joanna. Joanna, if you'd like another question, you can go ahead.
Yes, thanks for the extra question. I'm actually not sure if it would be Michelle or the mayor who would be best to answer this. In Toronto, Toronto had been calling on the province to make the vaccine mandatory for school-age kids, to add it to those school vaccines. The province has rejected that. Was Hamilton also calling for that? And what is your reaction to the province choosing not to make those, not to add that to the school vaccine schedule?
Thank you. Yeah, it was an issue, Joanna, that was raised at our Greater Toronto Hamilton Area Mayor's Caucus that we have every Monday. Wasn't sure if it was part of our collective communique to the province, but it was certainly discussed as something that we should raise with the province of Ontario. And to be honest, somewhat disappointed that they haven't made that a mandatory part of the process. Whenever we do this, when it's left to kind of choice or voluntary participation, it really doesn't behoove people to move too quickly. And so I think there's some urgency to having our children vaccinated. I think many parents are looking forward to getting it done. And I would hope that the province would be a little bit more aggressive in terms of making it a requirement for school-age children. And I know that many parents would have concern of some of the kids being vaccinated and some of the kids not being vaccinated. And some of the outbreaks that we're seeing are actually actively happening in our schools. So something that I would hope the province would pay more attention to and be a little bit more aggressive on. I think I do agree with Toronto on that.
Great. Thank you, Mr. Mayor. I think that's the end of our questions for today, so I will pass things back to you.
That's great. Thank you very much. And thank you everyone for tuning in. Thanks to Bill Custers and the entire team at Cable 14 and Clear Cable for making these 100+ media advisories possible each and every time. Thank you for all that great work. And of course, there is more information on COVID-19. If you need more information right now, you can go to hamilton.ca/coronavirus and learn about where our vaccination clinics are at the moment. And as was pointed out earlier, for those that have not had a 1 dose or 2 doses of the vaccine, you can go directly to any vaccination clinic and get vaccinated. So please do take the opportunity to do that. And again, thank you to all of those out there doing the right thing, working with our public health staff and all of our businesses out there to keep each other safe. And as we head into the next holiday season, do be mindful of some of the restrictive measures that are going to add to keeping people safe. Masking, hand washing, and some physical distancing is still something that we want to ensure people are mindful of as they get together now and through the holiday season coming up. So for the latest information on the city's website, go to .hamilton./coronavirus for all of your coronavirus information. And you can follow us on social media as well. Thank you all for joining us today, and we'll see you back here in a couple of weeks. Thank you. Have a great evening.